obviously there are some people who are hesitant to take the vaccine for various reasons, and some who may face some barriers. Has the province been able to, identify who those people might be, or the barriers or hesitancies, and how you might reach those people so they might get a vaccine?
Yeah, so this is something that we've spent quite a bit of time on for years and years, and we're using some of that data from the Vaccine Evaluation Centre. We've had a team at the immunization program and our BC Immunization Committee here in BC that have been looking at these types of questions for a long time, and it is something we look at across the country as well. So we know there's what we call the 3 C's, so there's complacency. And we know that that's an issue for some people. It's not that they're against vaccines. It's just that, it's not that big a deal. And if it's hard for me to get there, then I'm not going to do it. And that's one of the things that we're trying to make it available in way more places and make it easy for people. And to raise that awareness of how important it is that it's not just for you, and you may not feel you're at risk of COVID and don't really care about it, but it's for your community as well, because it means that we can best protect everybody. And it also means you'll get your life back in many ways. And there's confidence, so people who are confident that the vaccines are safe and effective, and part of that is us providing as much information as we know about vaccines, talking about why we think it's safe to mix and match, for example, what we know about how well they work, what we know about adverse events that happen after immunization, about safety, and all of that information is things that we're putting out for people, making sure that your healthcare provider has that information so that you can ask them questions. And that's a lot of the work that we're doing right now. And the third one is convenience. And right now, we're not seeing a lot of vaccine people who just don't want vaccine. It's much more about, is it easy for me to get? Do I have to take time off work? Where can I find it? Can I get access to it? So taking away those barriers so that you can get your questions answered in the language that you understand from somebody that you trust, and that the vaccine is brought to you as much as possible. So what we call opportunities for immunization. We don't want to pass any of those up. So we are absolutely using all of those things to understand where we're seeing each one of those and what are the strategies that we can use. And, things like in the interior, they did a mobile clinic at the Saturday Farmers Market, and it was just convenient for people, and they got their questions answered and got immunized. So we'll be doing more of that as we start to see things leveling off, particularly for younger people.